When I first started with treatment, there really was no certain way of knowing that I was going down the right path.
How do you really know when you're better?
Can I still dream all the things I dreamt and try to achieve them?
It's an illness separate from one's personality.
It is very possible to get completely well from depression.
Don't give up. There's always something new to try.
I know Annie would sing, "The sun will come out tomorrow." And you will feel better, you'll feel differently. Depression does respond to treatment. Depression is an illness. I think that's important for people to understand because a lot of people have this idea it's some form of weakness. It's a medical illness that impacts upon how you think, how you feel, and how you can function.
Last year, I had what I would consider to be my initial foray into a depressive episode, which was a life-altering experience for me. The lows, actually, in my life were unlike any that I've seen anyone else experiencing.
I kept having low self-esteem, thinking that this was just something wrong with me, something wrong with my mind, that I was deficient in some way as a person, as a character.
The fact that you feel depressed is not a weakness. It's an illness that can be treated. And the current thinking is that it really is biological and that there are real changes that one can see actually in the brain to show that it really is an illness and not just part of personality.
When I first got diagnosed, I guess the initial question was, what makes me depressed versus someone else? There's plenty of people who aren't happy. What makes it a problem? Where you have this disease versus someone else who just isn't happy.
We try to determine the difference between a simple blue mood or depressed mood and clinical depression using several things. One is, how long is it lasting? Two is, how severe is it? How many symptoms you have?
The first time I wouldn't even, so unmotivated to take care of myself, I would only shower once a week, if that, just because I didn't have the drive or motivation to even take care of myself.
When somebody's depressed, they don't want to do anything. They don't want to do any of their usual activities. There's a real lack of energy. There's a real lack of interest. And most of all, a real lack of pleasure. So things that used to be fun or entertaining aren't anymore. Depressed people often feel like they can't concentrate. So it's very common to feel like you just can't get started.
Lack of interests and motivation is one of the two main features of depression. The other one being low mood or sadness or emptiness.
People complain about, I'm tired, I'm exhausted, I just have no get up and go, or they have vague complaints, physical complaints, stomach problems, back aches, all kinds of aches and pains, and they're not realizing that really they're depressed.
I almost always had a headache, and I realized it was, I think because I was always mulling over the things that I was depressed about, but it was like a very specific type of headache that I only really experience when I'm depressed.
I think the link between bodily pain and depression is terribly underappreciated. We don't know exactly why people with depression hurt more, but some of the thinking would be that the ability to control pain, the mechanisms in the brain that help us control pain, the pain we feel and how much it bothers us, and the mechanisms that control mood and depression are very tightly linked.
I had a lot of questions with reference to why certain life experiences could trigger certain things in me that weren't being triggered in other people.
Well, clearly everyone is made up differently. We're wired in different ways. And some of us are more susceptible to depression or changes in our brain chemicals than others.
The vulnerability to this illness very obviously passes through families. And the reason why one person going through a very similar circumstance might get depressed and a clinical depression and another person would not is very often founded on whether they have inherited a vulnerability to get depressed in a clinical way.
Depression does not discriminate. Depression can find its way into any race, sex, age. Old people as well as young people experience depression.
When I was, first depressed, I knew I wasn't happy, but I wasn't about to go to a psychologist and say, what's my problem here?
A person can be depressed for years. If you don't seek help, it's possible, and I've seen many people who suffer like this, who suffer stoically or tell themselves that they shouldn't get help or are afraid of getting help and endure a depressive state for months or years.
I've learned that it becomes a hole that you kind of fall down into, like a downward spiral is the phrase a lot of people use. And the longer you wait, the further down you fall.
It's important to recognize that if depression is not treated, people can really become ill. They can get to the point where they would like to end their life or feel like it's not worth going on. It's important to have a connection with your therapist or doctor, to be able to talk about this honestly and be able to talk about it without feeling ashamed, to know that if you're thinking about ending your life, that's the depression that is speaking and that you need to get help.
One of the strange aspects of depression is the cognitive changes that are associated with it. A person may come to think genuinely and honestly that their life is never going to get better, that it maybe never was better, that their memory is so selective that they only remember the terrible parts of their past, or even parts that weren't so terrible they remember as being awful.
The way to know whether or not you have a big enough problem to get help is if it's really interfering. I always ask people, how much trouble is this causing you in your life? Are you having problems in your relationship? Are you having problems with family or friends? Are you having trouble at work? How much of your life is being interfered with?
I first decided to seek help when I realized I had to humble myself to the fact that whatever was happening with me was beyond my ability to make it better.
People have difficulty asking for help for depression because it is so stigmatized, and you never know where to go. There are so many types of professionals.
The first thing to do, I think, would be to talk to your general doctor, family practitioner or internist, and say, I think I might be depressed. The other thing is to seek out a mental health professional, either a psychiatrist or psychologist or social worker. Any of them are well qualified to treat depression and can steer you in the right direction.
Some people need medication, others need talk therapy, exercise, spirituality, and some need a combination of all of the above.
With the depth of sadness and emptiness that I'm feeling, with the true symptoms of the depression, how could a medication help me out of this?
Serotonin and norepinephrine are two chemicals that help transmit messages in the brain. Depression is not just a matter of not having enough of one or the other.
This is a biological illness, and that medicine can help put the chemicals back into normal working order.
There are many medications. There are different forms of psychotherapy.
One of them is interpersonal therapy, and that is therapy in which you really focus on what's going on in your relationships right now that might be causing the depression or exacerbating it, or may even be an effect of it, but you really focus on the relationships. The other kind of talk therapy that's very helpful with depression is cognitive behavioral therapy, where you work on changing the cognitions or the thoughts and the behaviors that may contribute to the depression. Neither of those go on and on and on and on. It can be quite short-term and can be very, very effective.
In a period when you're depressed and you're not able to communicate very well what you're going through, it's very hard to know what to ask or what to tell someone and what to ask them to do to help me, for example.
See me frequently would be a good thing to do. Tell me everything would be a good thing to do. Make me a list. Tell me about what hurts physically, about what's not right emotionally or mentally. Bring your concerns, be honest. Let's not hide anything, because if you do, I might not be able to help in those kinds of ways. And also, be understanding as a patient when I ask some very particular and maybe some very private questions. that might make you feel uncomfortable. When I do that, I'm not trying to place blame or to increase any kind of stigma. But on many occasions, some direct questions about substance abuse, alcoholism, other chemical use are extraordinarily important in terms of getting well. Avoiding alcohol while on antidepressants completely, in my opinion, would be important.
I have definitely been guilty of always making everything look rosy-colored with reference to what was going on with me psychologically. Even when I was in the throes of depression, doctors would walk into the room. They had a nickname for me, and that was Mary Sunshine. I was always upbeat, and you could tell there was a lot of suffering going on beneath, but I wasn't really coming across with it.
Faking it never helps. Because it only disguises symptoms or conditions that are important to include in the treatment equation and in the diagnostic equation.
If I don't know what's going on, I can't really offer very good suggestions. And if they don't trust me, and I don't project being trustworthy, then there's low likelihood that they'll follow what I suggest, or that I'll know what to suggest. It's a very complicated business. It isn't just here, this one pill fits everybody and you'll be better in 3 days.
When you start taking a medication, you do feel it work, and it feels good because you don't get as upset, but at the time it kind of feels scary because you're wondering if it's changing the way you feel about things, which will ultimately change your personality.
Treatment doesn't change the actual personality. You know, people get depression and personality confused sometimes. Personality is a set of enduring traits that we have over a whole lifetime. And depression is an illness that you have at a particular point.
I've written volumes, I've been published in small scale and different venues, and I was very terrified. The reading that I did told me that the medication may very well work, it'll keep me stable and keep me healthy, but it may dampen that creativity.
What I usually say to that is you are so depressed right now that you're not being all that creative and you're not actually being all that productive. Let's try to treat the depression and see how you feel. You can always go off of medication, you can always stop coming to therapy, but right now you're really miserable. So let's see if first step is to see if we can have you feel better.
I went to my doctor. I said, I know that I need to take this medication. We're hoping that it's going to lift the depression. I'm experiencing side effects. How can I reconcile that? Is there a way that these side effects do not have to be?
Any medicine in the world has side effects. There's no way of getting around it. Happily, the side effect profiles of the antidepressants we've seen over the last few years are much more tolerable than the ones we've had in the remote past. Side effects tend to be mild and pass in the first week or two, sometimes nausea, sometimes a little jitteriness or something like that.
Different people respond to medication differently. Some people may have side effects that they might have some nausea, and the doctor might say, make sure you take the medicine with food to help with that.
Most of the time, the medicine should fit you well and should not bother you greatly. And if it does, then the diagnosis might be wrong or the medicine might need to be switched.
I was very afraid that medication might be addictive. I thought to myself, if someday along the lines it's deemed that I don't need them anymore, will I be able to stop taking them? If I commit to them now, will I always need them?
Medications are sometimes feared because they're thought of as nerve pills or addictive or something like that. I mean, antidepressants are not addictive in any way, shape, or form.
The issue is that you have to let your body adjust to the medicine, so we start slowly, and in the same way you have to let your body adjust to removing the medicine. So you don't want to stop it suddenly, you want to help it go away, take down the dose little by little so you don't have a side effect when you leave them too suddenly.
At the beginning of my depressive episode last year, I really felt like I needed hand-holding, so to speak. I was very scared, and I feel as though the intervention of the doctors, the fact that they did their very best to let me know that I was going to have to go through this, we would do anything that we could in terms of medications and therapy, anything that they could. They'd be diligent on my case, in my corner, so to speak, to help me out. That was invaluable to me.
Sometimes you really need a partner who can get in there and let you know that you're not always going to feel this way, you're not always going to function at this level, and that they can hold it, that hope for you, until you get yours back.
The most important question I had was, is it really going to get better? Am I ever going to feel like I used to feel, like whatever normal is?
When are these things going to start to happen for me? When is the medication going to start to work? When is this all going to be over so I can move on with my life and go back to business as usual?
Once you get on an adequate dose of the medicine, after a week or two on an adequate dose, things usually begin to turn around and move the right direction, but it may take 8 weeks, 12 weeks to get the symptoms to fully go away, and you don't want to stop adjusting the medicine dose or the medicine combination or whatever it is until you get fully well.
It was important for me to know, that is my medication working, and what do I do if it is not working? I mean, if I continue to feel the same way as I was feeling, or even worse, what do I do? What do I tell the doctor? Can he do something for me?
People who come in who are feeling hopeless or feeling under pressure, who are discouraged in treatment, don't give up. There's always something new to try, and there is always some new place to go. I mean, things happen all the time. I'm treating depression differently now in the year 2003 than I was in the year 1999, and getting more and more people better with the things we've learned and have available to us in the last 4 or 5 years.
It's very difficult sometimes for people who are depressed to sustain their treatment, both for talk therapy and for medication. But I always try to emphasize how important it is to keep with it. You know, the medications need to be taken consistently, every day, at the same time. Therapy, you need to keep coming, and even when it feels like you're really slogging through molasses and it's hard to get going, you've really got to try to stick with it.
How exactly do you remain patient? How exactly do you feel heartened by the fact that things are going to get better, but they may get better in increments?
It's really important to take it one day at a time when you initially have depression. It's hard to believe that it's going to get better, that you're going to feel differently than you do today, but you will.
Once it was behind me, I thought to myself, can I close this chapter? Am I going to need to continually address this? Will I have to stay on these medications? Will I have to remain in therapy?
People should know that being treated for depression is a process, it's a journey. How long that journey lasts depends on how many times you've been depressed, what your vulnerability is, maybe what the circumstances were that triggered the vulnerability into depression. It's not a simple answer to give people. Generally speaking, no matter what treatment you choose, you'd like for the treatment to be continued for 6 to 9 months after the symptoms totally go away. And that's another key point. We want the symptoms to be totally gone, for the patient not just to get better, but to be well, if you will. Because we know now that people who get only partial improvements are the people who are going to get sick again almost immediately when the treatment is discontinued.
It's important to talk to your therapist about what it is you want to get out of the treatment, to talk about the goals that you have so that you'll know when to end your treatment, okay? We want to work on these particular things, and then I'm going to be ready to move on.
It is very possible to get completely well from depression. And the best way of doing that is to continue struggling to find the right treatment, the right support from your family and friends and, say, spiritual communities, to keep looking for a job or to continue at the work you have, trying to make it better and meaningful.
I knew, I think, for the first time that things were starting to look up and that the idea of being better was actually coming into view for me when I sat down and actually had a meal and could taste it and had the desire to have it again. My appetite returned. And I do remember quite poignantly the first time I smiled after so long, when the smiling was just unheard of for me. Those two events made me think things are starting to look up. What are the possibilities of re-experiencing depression once you've already gone through it? And succeeded in lifting yourself up? I guess that's a hovering question for me. It's one that instills some fear in me. Of course, no one wants to re-experience that.
I have a conversation with patients that sort of, focuses on, well, I'm glad we're doing better. Now, what are the chances that this illness might come back if we stop treatment? And for people who've had their first episode of depression, the answer would be about 1 in 2. For people who've had their 4th episode of depression, the answer would be about 100%.
The reality is that even if you do experience another depression, the treatment that worked the first time will most likely work again. And so you need to kind of be checking for yourself how well you're functioning. Are you irritable, angry with everyone, can't concentrate? To know your depression personally, because that's what you're going to use to be able to gauge whether or not it's getting in the way again in your life.
I've had questions about whether or not it's wise to disclose to your employer and or to friends, family, to what degree you should disclose once you've been diagnosed.
Telling people at work about depression is a very personal decision, and I never suggest to anybody that they do it if they're not comfortable doing it. And in most cases, they don't need to, because depression is treatable, and once it's treated, usually people function fine and don't need to mention it at work. But if they need to, or if they want to, if they have a close relationship with someone at work, they need to explain it again very matter-of-factly and clearly. I'm on top of it, I'm in treatment, this is what I'm doing, but I just want you to know what I'm going through.
The difficulty with trying to make other people understand or relating this to other people is that a lot of people tend to say, oh, I was depressed last Tuesday. Or, I've been depressed a couple of days, it just goes away, just snap out of it.
The truth of the matter is that most people don't know very much about depression. And so you're really going to be educating people about depression, helping them see that it isn't a weakness, that it's an illness, a physical illness, and that it's treatable.
People who are depressed, one of the main things that they need is people to help them in the sense of social support, people who can motivate them, understand them, care for them, watch out for them so that they don't spend all day in bed or quit their job for minimal provocation when if they just held out a little bit longer or got over one particular crisis, they wouldn't have so much of a loss in their life. So it's important to have an advocate, be that person a very good friend or a family member or a different kind of community member or spiritual advisor. I mean, any number of people are possible, and it's a very important part of recovery to have a network of people that can help you get through this situation.
For me, I have joined organizations and different groups to get together with people who have like diagnoses, and I know that it's been a very invaluable experience to me to have those supports. Get involved with your family if you can, and definitely find out a valuable checklist for yourself in terms of keeping yourself on track every day. This has helped me, and it continues to help me feel as though I know where I'm at, and I can see trends if I'm ever going in a direction that might require some more help.
Can I ever be just, the person that I used to be or lead a normal life like other people? Can I still dream all the things I dreamt and try to achieve them? Or do I have to curtail myself in any way?
I would say there's no reason to feel that you have to restrict any dreams for your life or any expectations for your life at all. Once depression is treated, you should feel fine and you should be able to pursue all the things you want to pursue.
Now, what is the opposite of depression? Well, you would want to say being happy, but you can't be happy all the time, and that's something you got to remember when you're getting better. I would say the opposite of depression is just feeling like yourself, being yourself.
I feel comfortable in saying that with the understanding, with the awareness of the process, that I will be stable for as long as I I hope to live. And if there are episodes, that they will be manageable.